I'd like to welcome you to Doctor in the Making, where we will be discussing all topics related to medicine with the top influencers and doctors in the state of Florida.
Hi, I'm Dr. Pero, and I wanted to talk to you a little bit about flat feet and lots of pain that can cause. Flat feet is a pretty common condition a lot of people have since birth. Flat feet can be really painful throughout life. Sometimes it can cause pain in the foot, the ankle, the knee, the hip, and even the back. There are lots of treatments for flat feet. Usually people will start off with some kind of orthotic or an arch device to raise the arch back up. Some people are successful with this. Sometimes you're lucky and you can use an over-the-counter device that is just sold by size. They're usually a little bit softer, maybe not as firm. If those don't work, you can get one through a doctor's office that usually is a little bit more firm. It might give you some more support in that area. And then there's custom orthotics can be made in many different ways that are custom fit for your foot and your foot only, kind of like prescription eyeglasses that'll help align the foot a little bit better and correct that flat foot. You know, mostly the talotarsal joint between the talus bone here and the calcaneus, whatever's going on in that joint usually kind of is going to determine what kind of arch you have when you're standing. Now that joint is supposed to have a certain amount of motion, just like any other joint in the body. But if there's excess motion there and the talus is moving maybe too far forward, down, to the inside, or maybe if it's inverting like this, those are all conditions where you're going to lead to a condition called pronation, where the foot flattens out too much rather than coming up the other way, which is supination. And when you're pronating too much, that's basically the flat foot. There's instability in that joint there, the arch collapses, and that can lead to a lot of other problems within the foot because everything's going to be misaligned as well. And then your feet being your foundation, you can see if your foot is flattening and your heel's going out this way, that's going to really have problems up in the ankle, the knee, the hip, and the back as well. It's basically like the foundation of a building. If you're building a building and the bricks on the bottom aren't straight, the rest of the building is going to be lopsided. And you know, lots of people can have this for a long time, treated or untreated. And if it gets really bad, not only can it have really bad effects in the foot, where eventually you might need a major flat foot reconstruction surgery with a lot of bone cutting, fusions, tendon transfers, and things like that, but also, you know, knee surgery, hip surgery, replacements, back problems and back surgeries and injections and things like that. Sometimes if you can catch the flat foot when you're younger before it gets really bad and correct the flat foot very easily, you can prevent a lot of these problems later on in life from happening and save yourself a lot of pain, suffering, and a lot of surgeries too. So let's talk more about this joint, this talotarsal joint. Talus is here. It's basically the bone that's underneath the ankle joint. And then the calcaneus is the heel bone here. The joint in between is called the talotarsal joint. Now on the outside of the foot, you'll see the joint space there. There's a naturally occurring space there called the sinus tarsi. Okay, and that goes all the way through the foot, and you can see it come out the other side there. Now, that naturally occurring space, if there's too much motion in that joint, it's basically that space is going to be obliterated, and you're not going to see it on an x-ray usually. That space should be open to a certain degree. Now, there's a way that we can do a very minimally invasive surgery that can be done under local anesthesia, even in the office, where we can put an internal device. It's basically a stent or an implant. It's made of titanium. It goes right in that sinus tarsi right there, and it helps block all of the excess motion that you might get if you have flat feet or overpronation or hyperpronation syndrome. And basically, when the orthotics don't work, that's usually the next step that we think about, is maybe doing an implant. If someone is a good candidate for the procedure, we'd have to look at weight-bearing x-rays and things like that and take some other things into consideration. Patients are walking same day in a cam walker boot for about 2 weeks. And then after that, we transition into like a regular tennis shoe or a sneaker, something soft and comfortable. And then start a little bit of physical therapy for a few weeks. If you're having any pain, or if anyone you know, your family or friends have flat feet, give us a call if you want to learn more about it. There's also a website, HyProCure.com. We have various websites through the office too here at Integrative Foot and Ankle. Thanks.
Thanks for watching. If you like this video and you want to see more, click the like button below and follow me on Instagram at DoctorInTheMaking_. Also, if there's a topic you'd like to see us talk about, make sure you let me know in the comment section below. And always remember, be grateful.